scholarship allowed me to produce videos of young people with a lived experience of an eating disorder who shared their experiences and provided messages of hope and recovery for participants in the online prevention and early intervention program.
The Grace Groom Scholarship allowed me to have a huge boost of confidence at the time, which I really needed being so early in my research journey. It actually also gave me a really significant portion of funding that helped me to advertise my research project to the wider community and actually get a lot of participants for my intervention, which is a key issue that we have when trying to develop a randomised controlled trial.
It really allowed me to engage more deeply with the academic community, and it supported specifically two different streams of activity. One was being able to disseminate my research internationally at a suicide prevention conference in Belgium, and the other was to openly share a scale or measure that I had developed to assess suicide risk.
What the scholarship meant to me was the ability to translate my scientific research in my PhD program into policy and training materials and training itself for community in Indonesia.
The pilot test we did was completed in northern Iraq, in an area that had been occupied by ISIS and had experienced lots of conflict and displacement for a lot of the people in that area. It was really good to have my research project recognised as being valuable and worthy of this funding. But secondly, it was also really helpful in having the funding that was able to support the planning and the implementation of the research that I did during my PhD.
The scholarship enabled me to run lived experience interviews of people living with BPD, which is arguably the most important part of my research, as our measure is only useful if it appropriately reflects the experiences faced by people living with BPD. It also enabled us to share our research with people in the BPD community so that we know that we're heading in the right direction. And it also allowed us to pay participants for their participation, as they are essentially experts in the area and should be compensated as such.
I was able to access specialist training, research resources and professional development. And it also helped me to disseminate the findings of my research. So I'm now heading into my third year of the PhD program, so I'm continuing to work on that research, and I'm also contributing to a range of other projects aimed at improving the lives and mental health of vulnerable children and young people in Australia.